Okay, welcome to the Deuk Spine Institute. We are performing a bilateral piriformis muscle release. Our patient has piriformis syndrome, which causes horrible lower back pain just at the top of the buttocks, and it comes from involvement of a muscle called the piriformis muscle. Shot? And the piriformis muscle runs from your sacrum and attaches over to the trochanteric greater trochanter. Okay. Shot. And this patient has pain. Let's go to a lateral view. He has pain in his buttock. The reason he has pain in his buttock is he has a torn piriformis muscle on both sides. So which hip do you think that is, Jordan? I think the higher hip is the right hip. We're on the left hip, so I think we need to... Are you superimposing? Yeah. He looks like he's leaning just a little bit. That's probably why. All right, not bad. Not bad. I think we're okay there. Thank you. If you can go back to an AP view. The piriformis muscle. Wait, before you do that, let's show our audience. Where's a pen? This will be a good teaching video. So the sacrum runs here, okay? That's your tailbone. And there's a muscle that comes from the sacrum, and it attaches, and it's a fan-shaped muscle. It attaches right here to the greater trochanter of the hip. Okay, we call that the piriformis. This patient has the same problem on both sides. That muscle has a tear, and it has inflammation that's causing horrible pain. Again, Piriformis, piriformis syndrome. We're going to release the muscle off of the hip bone. See, what happens is if the muscle gets injured like his is, then the patient just keeps bending, twisting, walking, using his hips, and he keeps tearing the muscle. And so, unfortunately, when you keep tearing the muscle, you just keep creating pain and discomfort. So, a little bit deeper, doctor, if you can. Shot. Alrighty then. Right on the bone. I can feel the piriformis. We're going to release it now. Yeah. Shot. Okay. Let me know when you're ready. So, the concept of releasing the piriformis muscle is not new, and Deuk Spine Institute is not the first to do it. The piriformis release is a procedure done by primarily orthopedic surgeons, and it's done when patients have a piriformis syndrome that just doesn't get better on its own. Okay. The other treatment for piriformis syndrome is to do an injection into the muscle, and that's typically our first line of treatment, and that's what we did for him. The problem is, unfortunately, it didn't last, and we knew it wouldn't last. Shot.
We have a question from Sherry on Facebook. How do you know where the tear is?
Sherry, we don't need to know where the tear is. We just need to release the muscle. So the tear is always in the belly of the muscle. Sherry? And the belly of the muscle is, I'll show you. I'll show you where the tear is in just a moment. Give me 1 second. Let me just finish doing the release here. And then I'll show you where the tear is. Shot? Nice. The tear is right here. Shot? See where the metal instrument is? That's where the tear is. Okay, point to it there, Jordan. The tear in the muscle is there. It's about from there down to, keep going, down to about right there. Okay? That's where the piriformis tear is. And that's where the sciatic nerve is running as well. It runs right over there by the tear. So we're not interested in going to the tear. We're interested in releasing the muscle so that the tear can heal. Only once the muscle is released will the tear heal. Again, it's a procedure that's been done for years by orthopedic surgeons, but it's done open, where they have to cut the patient's buttock wide open. Shot? And by doing that, you're actually creating more problems for the patient, more trauma, more pain and suffering. What do you think? What do you think it is? Yeah. Hmm? Shot? Shot? Very nice. That's right where that muscle is. Okay, we should be done. Let's get a quick lateral view.
We have a follow-up question from Sherry.
Remember, he's airplaned a little bit where the right side is higher. Yes, Sherry.
What do you mean by release? Are you disconnecting on the pelvic bone side?
Am I what?
What do you mean by release?
Oh, well, a muscle, it's two attachments, a bone on one side, a bone on the other, and those bones move relative to each other. AP? Release means you're taking the muscle and you're dividing it or cutting it and getting it off one of the attachment points. That's the treatment for piriformis syndrome that doesn't go away on its own. That's what this patient has. He has a residual or recurrent piriformis syndrome. And we release the muscle by cutting its attachments on one side, which is the hip side. We don't want to cut the sacrum side because the sacrum side is far more complicated and there's a lot of things over there. I think we're done. I feel pretty good about it. Shot? Yeah, we're done on this side.
Are you disconnecting on the pelvic bone side?
No, we're disconnecting on the hip side. Let's show the, turn the light on. We're done with the left side. Just move the floor out of the way. Okay. You guys see this? Where's the ruler? Here's the incision. It's 4 millimeters. 4 millimeter incision. Right here. We've basically detached the muscle from the hip. All right, let's go to the other side. Shot when you're ready. Okay, any way to rotate this in the hip in?
Yeah.
So push the knee this way
Yes.
and push the ankle that way. You need to come here and put your hands in there and get the ankle and bring it laterally that way a little bit.
This
You understand?
Bend the knee, yeah, bend the knee, yeah. And this, there you go. Push more this.
And let's get a shot. All right, that's not bad. Shot. Okay, it's not bad. That's good. I'm going to go in. Are you ready, doctor?
Yeah.
All right, here we go. We're going to release the right side. We've already done the left.
You can turn out the signal.
Shot. So I'd like to dock the tip of my probe on the back of the greater trochanter. Shot. And that's what I'm feeling right here. There it is. Shot. All right, so I'm right on the back of the greater trochanter. And that's right where the piriformis muscle attaches, right there. Now we need some more deep medicine. Do we have any deep medicine? Uh-huh. Almost done. I'm going to give him a little more numbing medicine deep down in there so it's more comfortable. Shot. Uh-huh. That's not bad. This will infiltrate the area. Shot. Oh, 3 minutes. Maybe 5 max. Depends on how much time I move around here. Shot. All right, so we've done some more numbing, and I'm already on the medial surface of the greater trochanter, and I'm releasing the piriformis. Can feel it releasing. Shot. And that's about as high as you want to go, superiorly. Shot. It's nice. And he's got some bad arthritis too in his hips. That feels like the femoral neck right there. Let's get a lateral and just take a look. So once again, piriformis syndrome, very common problem, found in 35% of patients with chronic back pain. It's due to a tear in their piriformis muscle. It's the only muscle that really tears. That's it. Yeah, we're up against the back of the... It's perfect. Let's go back with an AP. Very nice. Back of the femoral neck. The problem is, folks, every time you move your legs, you get up and walk, you sit down, you're literally re-ripping the muscle, re-tearing the muscle. That's perfect. Perfect position of our probe. I'm very happy with that. Should be done in 1 minute. Shot. Yep. Once again, the difference with our technique is we do it minimally invasive. Shot. So there's really very little bleeding. There's no downtime. And that should be it.
Sitting down, please. Thank you.
So 2 small incisions. You guys see that? Right there, Sanjay?
Yes, we do.
Uh-huh. And the problem, folks, is that, marker, the sciatic nerve, the nerve that goes down your leg, it actually, the tear in the muscle is here. This is the piriformis. The sciatic nerve literally comes out just at the bottom of the tear and goes down the leg. So a piriformis inflammation will actually irritate the sciatic nerve. That's your sciatic. And cause leg pain. So we're to the side of the sciatic. Go ahead and close these up. And thanks for joining us, and you can end the broadcast.